The Hijama therapy is an Islamic remedy and a common practice performed by the Prophet Muhammad, which is still carried out today around the world. So what is this Hijama therapy and what does it actually do? Well, let's find out a little more. Sonia Mumtaz spoke with Dr. Rizwan Suleiman, who's based in Bristol, to find out more on Hijama therapy.
Well, Hijama itself is just, if you want to describe what it is specifically, it's just applying suction on the surface of the skin, which is what we probably know as cupping in English. But it's a little bit different in the sense that after we apply the suction, we make tiny scratches on the surface of the skin and we reapply the cup. So it's a little bit like mechanical leeching is probably the best way to describe it. It's making small scratches on the skin and applying a suction over using cups or various kind of techniques just to create a suction, like a hickey.
You talked about scratches. I mean, do you formally scratch yourself on the skin, on the patient's skin?
No, when I say scratches, we use a sterile surgical blade and we just nip the surface of the skin. So I know it sounds quite, it doesn't sound too kind of easy to swallow. Someone's going to cut me with a surgical blade. It's not as invasive as it sounds. It's very much like having your finger pricked with a lancet when you have your blood sugar tested. So it's just a very small, tiny little nip. We do lots of tiny little nips on the surface of the skin. And the idea is just to create just a small break in the surface of the skin to allow a vent of any kind of stagnant blood or inflammation that might be in an area which is causing pressure and often pain, to help remove that, which helps kind of reinitiate the body's natural processes of healing.
Where does it actually originate from, Hijama therapy?
Well, hijama, the word itself means to suck. It comes from the Arabic word. So when we practice hijama, when we say hijama, we're rooting it back to an Arabic origin. However, hijama itself, or the practice, it can't be linked to any one culture, civilization, or kind of a country in a sense, because it's been used since the beginning of time, from the ancient Egyptians to the Chinese to Polish. I've met Polish patients; they're very familiar with what we're doing. They call it bunki in Polish. We have Malaysians; they call it Beckham. We have Somali cultures; they call it Tobin. In Kenya, they call it Janja. So in every culture that you go to, every country, every language, they'll have a word for it. And that kind of really kind of demonstrates the global kind of practice of it and how it has been recognized as an effective cure and treatment by pretty much every civilization. It's only recently, within kind of the 1800s, that hijama or wet cupping therapy, or kind of technically to term it, would be kind of scarification combined with cupping, or cupping form of bloodletting, has been kind of lost out of the medical system. So it's only our culture really, and in the West, where this has really been faded out. Everywhere else you go in the world, you'll find it there. You'll find it within cultures, and it's very, very prevalent.
So what are its health benefits?
This is a question that a lot of people ask me. How can you possibly have benefit from bleeding? And again, I think you have to have a bit of a scientific understanding to recognize the benefits here. A lot of our problems come from inflammation within our system. With cupping, we treat a lot of pain conditions. This is one of the things that we find is very responsive to the therapy. And a lot of pain conditions are associated very closely with inflammation. So inflammation itself, first of all, if we have to understand what it is, it's usually where we have an increased amount of blood in an area, where your body has a response and it sends more blood into a particular area. When you have that happening, it causes pressure. And because our bodies are a closed system, that pressure causes stretching of nerve receptors. The chemicals which are released in the inflammation, or inflammatory modulators, they cause pain as well, because they stimulate the nerve receptors, which again send all these messages of pain. Now, quite often we'll find a state of inflammation called chronic inflammation. Normal inflammation is actually a natural process, and it's kind of conductive to healing. However, when we have chronic inflammation, we get a process within the tissues where we have a perpetual cycle of tissue damage and pain, where the body gets kind of stuck in a way where it can't heal itself. So hijama comes into the picture in those situations where we apply a suction over the surface area where there's an increased pressure and where we have inflammation or stagnation of blood and fluids. We make these tiny little pinpricks on the surface of the skin. So if you imagine this like venting an area which is kind of filled up with pressure, and it has a lot of inflammation in the area, and we have stagnant blood, and we have kind of a chronic inflammation process going on, we put the suction cup over the area, we make these tiny little pricks in the skin, which is a natural way of venting that pressure which is built up in the tissues, getting rid of that inflammation, and helping the body restore its normal healing processes and kickstart its natural processes of healing.
Anyway, that's Dr. Rizwan Suleiman talking to BBC's Sonia Mumtaz. Now,